Dr. Diane Stoller is a nationally respected authority on brain health and rehab. One of her books on the topic is Coping with Concussion and Brain Injury. Recently on WKHM's morning program, we asked Dr. Stoller.
Concussions. Have you seen the movie yet?
Yes, I have.
What do you think?
Excellent movie. I've worked with the people. I went to Boston University where they're doing research on CTE, and this movie really has hit dead on. I think it's an excellent movie.
As you and your doctor determine if you are concussed, keep in mind.
There's a difference. There's a head injury versus a brain injury. A head injury, you have your scalp, your hair, your scalp, your skull, and inside the skull you have membrane, and you have your cerebral fluid, and then the actual brain is like soft custard, and it has made up of the vascular system, your arteries, veins, capillaries, and also your your neurons. Now, and they pointed this out in the movie, which I thought they did a beautiful job. A ram, a goat, is built for hitting at another goat head on. We are built that if you ran as fast as you could against a tree or door, you may have a head injury, but not a brain injury. So concussion is the causing dysregulation to the brain, and the symptoms from that is called post-concussion syndrome. And you can have mild symptoms, which you asked about. You could just be dazed or a little bit confused, or you can have very severe symptoms where you don't remember who you are. You can have memory loss. You can become very irritable. And so depending on how much tearing and shearing of that white matter it happens, and then if you have one hit after another, if you don't give time for that brain to heal, that's called second impact syndrome. And the second time you get hit, it's not one-on-one, it's not arithmetic, it's geometric. So the next hit is many times worse than the first.
Dr. Stoller is not a fan of youth football.
Kids under 10, should they be playing football?
The answer is that kids under 10 can play flag football, touch football. They should not be wearing the equipment. No.
So no football.
Okay. No, because their necks are not developed yet. Mm-hmm. And so remember I was telling you about that whiplash? They can just, by putting just the helmet on themselves, if they were playing touch football, flag football, and I would even say as you're getting older, even in junior high or middle school, play rugby, you're still having the same sport, but the neck has not been developed enough, and the brain hasn't been developed. The connectivity to the frontal lobe that allows you to make your decisions and make good judgment starts at 4 and doesn't end to 24.
We asked the doctor if the helmets help, and she says not necessarily for the little ones.
If you're an equestrian, absolutely wear that helmet. If you're on your bicycle, absolutely wear the helmet. I'm saying that little kids should not be wearing football helmets and hitting someone with intention, which if you watch some of the little peewee football, that's what they're doing, telling the kid to hit the other kid with his head.
Dr. Stoller, who does acknowledge she has some National Football League patience, she does cut the NFL some slack because of recent medical advances.
In all fairness to the NFL, I'm going back to the point that in 2000, and this is crucial, is that, as I said, in Boston, that Beth Israel Hospital was saying there were staff neurologists there that said there was no such thing as a mild traumatic brain injury. So because there was not any way of measuring it like you can do if you had a stroke or a bleed, which you can see on a CAT scan or a traditional MRI, where MRIs just came about in 1994. So people don't realize some of these equipment that measure it, but the fact is that if there was nothing that they could see on an X-ray or anything that was injuring the brain, as you could see a tear or a broken arm, they were just saying, the person just needs some rest. They were not seeing the severity.
Dr. Diane Stoller. For book information, drdiane.com. Over a third of the people who took Michigan's exam to become